can do to your health, all right, to really honestly think about it, it causes heart attacks, yeah? It causes a number of high blood pressure,
really
a number of
really big major conditions. Yes.
You're obese and you work out, you eat well and you don't know what's up, sleep.
Yeah, and I think also it's very key also to mention, especially we, the three of us and many of the morning crews and radio, in hospitals, people who've lost that biorhythm, it's very important for you also to have a bio clock.
Yes.
Because most of the times you wake up maybe at 3 a.m. at night, then in the afternoon you're asleep, at night you're really struggling.
It is hard.
And you don't have that deep sleep, you know, where you have the rapid eye movement.
Yes.
Because you've interfered with your circadian rhythm, so of course there are bound to be problems. So how do we adjust? Because we're not quitting Jubo.
Exactly.
So I hope she can also give us solutions.
Yeah, and doing it for a long protracted of time, how does it adversely affect you? Because sometimes you don't really realize that something is really happening with you. You're doing it, it's piling up.
Slowly,
By the way, and that's one thing about sleep that a lot of people don't pay attention to, is the kind of long-term effects it will have on you. Because it's one of those things where we think it's for us to pick and choose how many hours. You want to play a little bit extra, you want to go out for an extra hour, and you don't realize like what it'll do for you long term. So those are the things we'll be talking about. But first, take a look at this, guys. Not sleeping enough and not sleeping well is certainly not okay and not good for your health. As a matter of fact, there is quite a price to pay. It may surprise you to learn that chronic sleep deprivation, for whatever reason, significantly affects your health, your performance, your safety, and even your pocketbook. There are many causes of sleep deprivation. The stresses of daily life may intrude upon our ability to sleep well, or perhaps we trade sleep for more work or play. We may have medical or mental health conditions that also disrupt our sleep. And be well aware that we are sleep deprived. However, it is critically important to realize that sleep deprivation is very often due to unrecognized sleep disorders. After a typical night's sleep, you may not feel restored and refreshed and be sleepy during the day, but be totally unaware that you are sleep deprived or have a sleep disorder. You might think it's just the stress of work or the kids or money, or you might have always felt this way and had no idea that you should actually feel differently. This lack of awareness compounds the consequences because so many people remained undiagnosed for years. The good news for many of the disorders that cause sleep deprivation is that after risk assessment, education on the subject, and treatment from your doctor, your body has a memory and is able to get back into the sleeping pattern that is best recommended for you. In the long term, the clinical consequences of untreated sleep disorders are large indeed. They are associated with numerous serious medical illnesses, which include high blood pressure, heart attack, heart failure, stroke, obesity, amongst very, very many other issues. With the wealth of information and treatment options available for sleep deprivation, much of the suffering, illness from the many related diseases, increase in accident rates, and effects on productivity, performance, concentration, and memory can actually be avoided. Increased awareness is the first step for us individually and the healthcare community. Some researchers suggest that sleep deprivation should be recognized with the same seriousness that has been associated with the societal impact of alcohol. Yes, indeed, sometimes we think that we've got it down because we love it so much, but sleep can actually cause death, lack of it. And of course, This morning, we are going to give you a lot of advice on how you can improve on your sleep, and of course, overall health will be affected that way. Welcome back to the show. Good to have you here, Dr. Cathy Syengo. Well, today, did you sleep okay before we even start?
Yes, I did.
You slept well? Okay, good. So did I. I slept very well. But there is something to be said about us not being very aware as to how much the stresses that compound our daily lives can actually affect our sleeping patterns, which then, of course, affects our health. Let's talk about that. There's a very stark and clear difference between insomnia and sleep deprivation. Give us an overview.
Okay. If we may start by defining insomnia, insomnia is actually lack of sleep, which eventually affects your day-to-day performance.
Yes.
And the person is actually not happy with the amount of sleep they are getting, and it shows in their performance and also in their health status.
Right.
When we talk about sleep deprivation, insomnia is not necessarily as a result of sleep deprivation.
Okay.
Because when you talk of sleep deprivation, we are talking of you would like to sleep, but probably because of your work schedule or because of a baby crying or because of a pain of illness you have,
Right.
you are not able to sleep. But otherwise, if you're given the chance to sleep, you'll be able to sleep.
Okay.
But there are people who, they are in a comfortable bed, but they are not able to sleep. That is
Right.
now what we define as insomnia.
Insomnia.
Yes.
Sleep deprivation is something that we can actually change, and of course it's based on our patterns, our daily patterns.
Yes.
Before we even get into what kind of habits actually really affect us when we're going to sleep, let's talk about the amount of hours a human being is actually supposed to have, because you hear 8 hours, and you hear some people say you shouldn't really sleep more than 6 hours. When you're a baby, it's 22 hours and you're happy, you
Yes,
know?
yes.
Let's talk about a human adult. How many hours should you have in one night?
Basically, on average, people should sleep for about 6 hours and a half, 6.5 hours. But there are some people who are short sleepers and
Yes.
the others who are long sleepers. When we talk of long sleepers, these are people who would have had 7 hours of sleep,
Yes.
and they are still tired during the day, and they would require more sleep.
Yes.
But there are people who would still do like 6 hours or 5 hours, but they are able to perform very well. They are short sleepers.
Right.
Again, as you mentioned, the age is also, for babies, they sleep most of their time.
Okay.
As we age also, our sleep decreases.
Right.
Yeah, so there's that change as per age.
Okay.
But again, what is important is how you feel during the day. If you're a short sleeper, during the day you will be feeling rested and you'll be able to perform well. If you slept few hours and you needed more sleep,
Yes.
on average 6 hours and 6.5 hours, then you'll be tired during the day and your performance will be affected.
Right.
Yes.
There are some serious consequences of sleep deprivation, and these vary from your health into every single day occurrences. A person who has not had enough sleep shouldn't really operate a vehicle.
Yes,
You
you're
know,
right,
shouldn't
yes.
really go into their job in a factory where you're
Yes.
operating heavy machinery.
Yes.
If you're a doctor, and they're, I think, the most affected. And
Yes.
I literally feel for doctors so much. I don't even know how they deal. Because you'll find a friend of mine, she tells me, Kobe, sometimes I sleep for 1 hour. And it's like, for 2 days, I've slept for 1 hour. And it's one of those things, you know, you're thinking, should this person be treating patients, you know? Let's
Yes.
talk about what sleep can actually do to you if you don't have enough of it and long term.
Okay, if we start with the short term,
Short term, yes.
of course, attention, judgment, and memory will be affected.
Right.
And like the example you've given of a doctor who is seeing patient, it means they'll even prescribe, forget what to prescribe. They might not be attentive to the symptoms and the signs, or when they examine the patient, they might not be able to remember all that.
Right.
But in the long term, we know it is associated with even heart diseases. It can cause even hallucinations, and it can cause death. Laboratory animals who
Right.
have been subjected to excessive sleep deprivation, some of them have ended up dying.
Right.
So it could affect our health in terms of our heart conditions. It can even predispose you to diabetes. It can worsen. It can, in the long run, it can even make you have major depressive episodes.
Right.
Yes.
Okay. And you know, it's funny that people don't pay attention to that fact that, you know, the moment that you're cutting your hours by 3 hours or you're not sleeping well due to stress and things like that, that's what we're talking about today, is actually stress.
Yes.
And it's funny that stress causes you not to sleep, right? and you not sleeping causes you stress. The two go hand in hand.
Yes.
What are some of the things that you should be able to recognize very earlier on if you're not sleeping well and if it's new? Some people have been living with a condition for years and they think it's normal. But all of a sudden, you're starting to get a bit stressed, you're not sleeping well. What are some of the things that you can do right away?
When somebody has not had enough sleep and they've not rested, they are, during the day they might be irritable.
Yes.
Their relationships at work might not be good. Again, their performance at work will not be good. But again, there's this worry of not sleeping, and it becomes a vicious cycle. I was not able to get enough sleep. I worry that when I get into bed today, I'll not get sleep.
Right.
And the problem worsens. The anxiety also increases because we know anxiety, excessive worry can make you lack sleep.
Right.
But again, now, even worrying about not sleeping increases the rate of anxiety. And at the end, we know anxiety, depression will also lead to increased heart diseases and many other complications.
Okay.
Yes.
I'm just going to read out a list to you, my fellow Kenyans, so you can hear some of this. In the long term, the clinical consequences of untreated sleeping disorders can cause high blood pressure, heart attack, heart failure, stroke, obesity, psychiatric problems, as you've mentioned, including depression.
Yes.
Really?
Yes.
You can get depressed from not sleeping?
Yes.
That's crazy. Attention deficit disorder, mental impairment, and this is very key for mothers to know, fetal and childhood growth retardation.
Yes.
We have injury from accidents, as we've said, disruption of bed partner sleep quality, and an overall poor quality of life.
Yes.
Let's talk about what lack of sleep can do to you mentally. And really, I think the issue of depression is big. And you're walking around feeling sad and you think things are not going well, and it's really just the amount of hours that you're taking in. Talk to us about that.
Yes. You see, the irritability which will come as a result of not sleeping, first of all, your relationships will be interfered with.
Right.
If it's a parent, probably you'll have outbursts with your children, with your spouse.
Yes.
If it's at work, you might not relate well with your co-workers. And so all those outbursts will affect your relationships. But again, because sleep is so important to our brain,
Yes.
Eventually, with long-term sleep deprivation or lack of sleep, you eventually now start breaking down, because we know when the body is exposed to excessive stress, eventually you break down and you could get depressed, and depression can be very severe at times, warranting even admission.
Okay.
Yes.
All right. So, I mean, there are two things. There are some people who have lived and suffered with it for years and they're okay. Then there's some people who are just starting maybe now to go through it, issues of money, family, relationships. Is it true, and I feel like this sometimes because of this job, I literally wake up 1 minute before my alarm, and this has been going on for about 7 months now. 1 minute every day. My alarm doesn't ring, I just 1 minute before my eyes open up. And there's something about your body clock and your brain and your body just being very aware of this pattern. And it's very hard then to break that pattern. And the body has a good way of sort of adjusting and having this, I guess, mental memory, if you can call it that. Then it's okay, right? Your body can adjust to a lot of conditions, a lot of harsh conditions. Don't you think so?
Yes. Yeah. Actually, what matters is the amount of total sleep you get in 24 hours.
Okay.
Not really the exact time. Because like for you, if you have to wake up very early, what matters is if you went to bed early, for example, at 9, and you had to wake up at 4 or at 3. So long as eventually you have a restful sleep, then your body adjusts. But we also have shift workers who today they are doing a night, tomorrow they are doing the day, as opposed to you who knows every day I must be here for the morning show. There are people who today they are doing a night, tomorrow they are doing a day, or 2 days of nights. Then when the schedules are so disorganized, sometimes the body doesn't adjust. Or for people who travel a lot, or even pilots, like you're in Africa today, tomorrow you're in the US, you stay there for like 3 days, you come back.
Issues of jet lag.
Jet lag, lighting also, and your body takes a while to adjust. But overall, if your sleep schedule is regular, such that even if you slept at 7 and every day you woke up at, so long as after 6 hours, you woke up at 1 a.m. And that is your schedule every day. Then so long as during the day you're feeling rested, you don't have to sleep like everybody else who sleeps at 10, for example, and wakes up at 5 or 6. So basically it's about the amount of hours you sleep, and also whether you feel tired or rested during the day. There are people who will require like 5 hours and they're okay. During the day they can they are stable.
Yes.
But there are other people who need at least 7 hours to be able to function.
Okay.
If this person gets 6 hours, they are not able to concentrate. So it also differs. Again, in women,
Yes.
it's more in women. Sleep
Okay.
disorders are more in women
Yeah,
than men.
we think too much, don't we?
Yes, and most of the time, especially for women when they have a newborn baby
Yes.
who wakes up at crazy times. Again, menopause also, there are people who get sleep insomnia
Okay.
at menopause.
Yes.
And even when the other symptoms clear, it stays on.
And we tend to worry a little bit more
Yes,
than our
yes.
male counterparts.
Yes.
All right, my dear people, I believe we have a caller on the line. Good morning. Hello.
Hello.
Good. I thought you had fallen asleep on me.
No, I cannot.
You're awake, sir. How are you doing?
I'm doing well.
Excellent. Do you have a question or a comment, George?
Yes, I have a question to Dr. Syengo.
Go for it.
First, I want to thank her for being a modern psychiatrist.
Yes.
She did answer his question very well. Now, I think I have mentioned that I deal with the problem of drugs and alcohol.
Yes.
And you find that personally I had a problem with drinking. And I understand, I wanted her to discuss this as a professional.
Yeah.
Because when you are drunk and you sleep,
Yes.
actually that sleep is artificial.
Is it?
And the many years you drink and you continue drinking, you actually have a debt, a sleep debt.
Okay.
So the moment you are out of drinking and you recover and all that, sleep comes so naturally.
Okay.
And, you find in most rehabs, in the program, they try to advise people to sleep. If you feel like you can take a nap, you take it because you may have that debt. I want to hear from the psychiatrist what's
Okay.
in that. Then
Okay.
I live in a hello.
Yes, we can hear you. Continue.
I also live in a place whereby we have disrupted sleep patterns. There are motorbikes all over. Some
Yeah.
with loud exhaust at night.
Noisy environment, huh?
Yeah, crowded environment.
Uh-huh.
So how would you deal with that? Because at night around 3 you are woken up at 1 a.m. and they are so loud and there's no control on such things.
All right. Very, very good questions indeed. Thank you for calling, George. Let's start with the first one.
Yes.
Issues of substance, alcohol, pills, drugs really
Yes,
affect.
what
yeah?
we call substance-induced sleep disorders.
Okay.
Many people, when they are not able to sleep, they self-medicate. Some will take alcohol to be able to sleep.
Yes.
But alcohol will induce sleep, yes, but only for a short time.
Okay.
And during the day, you will not feel rested. So again, there are people who didn't sleep during the day, the night. During the day, they have to work, so they take a lot of coffee.
Right.
Eventually, it ends up now also contributing to the insomnia during the night.
Right.
So most of the substances which are abused, even tobacco, cigarettes,
Yes.
can interfere with your sleep.
Oh, really?
Even hard drugs like heroin can interfere with your sleep. And the commonly abused drug for sleep is actually alcohol.
Right.
So our caller is very right. And the best thing is to actually sort out the issue which is causing the sleep problem,
Right.
not to self-medicate. Because even the drugs we use to induce sleep for initial evaluation, eventually people can get addicted to them and reach a
Yes.
stage where they are not able to function without them,
Exactly.
to sleep without them. So it's good to sort out the problem. If it's your work schedule, see how you can sort it out,
Okay.
and see what areas of your life you can delegate to other people. If it's an illness like pain, if you don't treat the pain, then sleep, you will not be able to sleep. If it's uncontrolled diabetes, you need to sort it out. Like breathing problems in
Right.
children, what we call adenoid hypertrophy. There are some children who snore a lot
yeah.
and they're not able to sleep. Unless those adenoids are removed, then the child will continue having problems. During the day, they'll not be able to concentrate in school.
Right.
So it's always good to evaluate and see what is causing this sleep problem and deal with it rather than self-medicate. Because when you self-medicate, you'll not get enough sleep, you'll not get restorative sleep, and it becomes a vicious cycle.
Absolutely.
Yes.
There's nothing worse than staying up at night worrying
Yes.
and things
And
like
then
that.
to the second caller who
Yes.
mentioned about the environment.
Right.
Things like noise
Yes.
and lights. He mentions that there's a lot of noise where he lives.
Around him.
Yeah.
Yeah.
And that's why we need to call in NEMA to
NEMA,
help
I'm
us.
telling
because
you.
some estates are so noisy.
Yeah.
Children have to sleep. Some are playing music until very late.
Yeah.
I think something needs to be done about that.
Okay.
Because it becomes very stressful. So noise, light, excessive lighting also can interfere with people's sleep.
But I'll tell you what, Sheila, my beautiful co-host, is a very light sleeper. So you know what she does? She puts earplugs, right? And they really help her out. And so George and many people, I had a car alarm yesterday from 9. When I woke up this morning at like 3 something, it was still going on. So I can imagine the amount of people that little car alarm has actually affected. Just put some professional, not just cotton wool, because then you'll have ear problems. But there's some, and they give them out on planes or whatever. You can find them anywhere at a chemist for nothing almost. Just plug them in, and they help. They really do help. Also sleeping with music, some nice soothing kind of spa music, ocean music also helps people fall asleep.
Actually there is self-hypnosis. There are CDs we have which can actually help you go to sleep. It's usually a background of oceanic waves with some meditated words like I believe I can relax, because we say whatever you can confess with, whatever you confess, you actually, if you confess that I'm going to sleep, I'm going to relax and sleep, and you actually sleep. So there's that CD where you have background oceanic waves with those words in the background played. And most people are able to sleep with that.
All right. We have a caller on the line. I want to ask you something after this call about when you do stop drinking and you do stop smoking and you do stop taking the drugs, you can't sleep.
No, you know, when somebody has been taking a substance
for
a long time, when they stop suddenly, there's the withdrawal. So, like if you've been having to sleep on alcohol and you stop suddenly, if there's no treatment for the withdrawal, then you get withdrawal.
That's
sleep,
one of the symptoms.
Excessive insomnia. So long as you give it time, the withdrawal must be over. That takes about 2 to 3 weeks. So if after the 3 weeks, then the sleep problem is still there, then it needs to be addressed. Because you might find that the sleep problem initially was somebody started self-medicating with the alcohol or the other drug, and now even after removing the alcohol, the sleep problem is still there. Yes.
Right. We have a caller on the line. Good morning.
Good morning.
How are you?
I'm fine. My name is Jack.
Hi, how are you doing, Jack? Did you sleep okay?
I'm doing fine. I have a question to the doctor.
All right, go for it, Jack.
Okay. I am a security guard. And in the morning, during the daytime, I'm a student in the university. Okay. How to balance this is just a problem because I'm having problem in when in class.
Concentrating.
Yeah, and also maybe in the vehicle when I'm commuting back home.
Yeah.
I'm never awake.
Oh wow.
So am I in the part of the section? What can I do to balance this?
Before the doctor answers, Jack, let me ask you something. What time is your work shift?
From 6 to 6 p.m. to 6 a.m.
All right, so you've got one of those crazy shifts, all right?
Yes. Thank you very much. What he needs to do is to make sure that at least he gets the 6.5 hours per day. So even if he does a night shift, then he needs to plan to have at least 6.5 hours of sleep. Then if he has to go to class, then he'll do it in the afternoon. But we know that most people work at night, and during the day they also want to continue working. They don't value that sleep is very important. So everybody needs to recognize that. And again, students, we see students who transnight. They think that if they read throughout the night, they will perform better. They don't remember that lack of sleep interferes with the memory. And so if you don't sleep, then whatever you've been reading will not be encoded, because memory is encoded when you are asleep. Yes. Yes.
And so, Jack, do you sleep every day at the same exact time? Would you say that you have a very regular pattern every day?
No. You see, it's always constant supervision. So when you sleep, it's just like it's like stealing time to sleep.
Oh my goodness.
Yes, there's something we call sleep hygiene. Which actually can help many people who don't have serious sleep disorders. Sleep hygiene, where we say stick to a specific schedule.
Right, set your bedtime at a regular time every day.
So if your sleeping time, you've chosen it to be at 10, let it be 10. Let there not be major changes. Like today you can sleep at 10, tomorrow at 11, tomorrow at midnight. And this also applies to parents who have children who are going to school. You find parents over the weekend, they allow their children to sleep until 3. I mean, to stay awake until 3 or until midnight. And then on Monday, you want them to automatically go back to their schedule.
It doesn't work, does it?
They need to be trained such that even over the weekend, the sleep variation, the sleep schedule is not so wide. Again, not taking coffee at night or other stimulants, including alcohol.
Okay.
People will think alcohol will induce sleep. Yes, it will,
Yeah.
but you might just sleep for 1 hour or two, and then the sleep is gone.
Can I ask you about
Yes.
Jack? Jack, you said that you sleep every time you're commuting back home, yeah?
Yeah.
What
In
is
the-
what
in
what
the
is-
bus.
Yes, in the bus. The benefits of a power nap. Can we talk about that? It's okay that he naps when he's going home, right?
Yeah, I would say yes and no, because for people who have problems sustaining sleep, if you take naps, let me not say during the day because he works at night.
Right.
If you take naps at the time you're supposed to be awake, asleep,
Yes.
awake,
Yes.
then it means the time you want to sleep, then your sleep is interfered with and it's
So
reduced.
it'll
But there are
actually
people
affect you
who
later.
actually can nap during the day and still sleep during the night.
Okay.
It depends on what personality the person is.
Okay.
Yeah, but you see what is happening to him, his body is automatically compensating.
Okay.
So that the body has learned that he never takes time to sleep, and so
Wherever he
whenever
is.
the time comes in a bus, he
Yeah.
will sleep. But there's dangers of being robbed in the
There
bus.
you go. Jack, you
Yes.
have to take care of yourself. And it's true, your body has actually gone into its own pattern and
Yes.
clock where it knows at this time, this is where you can rest. So that's why you keep falling asleep when you're commuting.
Yes.
Yeah.
Yeah, so there are some things like setting a regular bedtime for yourself every day without fail.
Yeah.
You have to sleep at the same time, and then nap wisely. Yeah, don't just nap all willy-nilly. Sindio?
Yes.
Yeah.
And not watching TV at the time you expect to sleep.
Yeah.
Exercising during the day, or like for him,
Even your diet.
yeah, even diet.
Yeah.
Yeah, whatever diet, you need to be conscious, like milk in the evening can
Yes.
also help you.
Okay.
Although I'm not saying everybody should take milk.
Yeah.
It depends on the total calories you
Okay.
need for your body. So again, you'd rather play music, audio, not TV. You know, when you
Yes.
or computer, when you stimulate
TV is
yourself,
bad for you
and
sometimes.
computer, also laptops in the bedroom.
Yeah.
That makes your body think that the bedroom is for working and not for
Exactly.
sleeping.
So Jack, there you have it. I think you've gotten some seriously good advice, okay? So we're going to test you between now and next Monday.
Yeah.
You take 7 days,
Yeah.
change your patterns,
Okay.
sleep at the same time every day,
Yeah.
right? Try not to stress out so much about school,
Okay.
all right? And then eat very healthily, just for 7 days. Let's see if next week, beginning next week, you'll sleep better.
Okay.
Yeah, I'm sure if you take some of these tips and expert tools that the doctor has given you, you'll be all right.
Okay.
All right, but we wish you a good night's rest. It's important.
Thank you. God
You're
bless.
welcome, absolutely. Because he's going to school so he can better himself,
Yes,
you know.
yes,
So,
which
so-
is very good. And he can actually adjust because
Yeah.
he has 12 hours. He works during the night, he has
Yeah,
12 hours.
yeah.
So even as we don't sleep the whole night,
Yes.
so he can still adjust, get at least 6 hours from the day,
Yeah.
and can be able to study in the remaining 6 hours.
Exactly.
He needs to reduce even the units he's taking in school, in the university. Most people
Right.
can take less units.
Yeah.
Not to take all of them and want to finish
And
in a short
it'll
time.
end up stressing you
Yes.
a lot more.
Yes.
So in terms of sleep deprivation, what we're talking about here are some of the things that you can do. But you've said something that is so key, and I wanted to talk about this. Children, right? Different parents have different patterns for their kids, and they base it on lifestyle, on their own, I guess, upbringing. But and I don't know why, I tell this to my niece all the time. I'm like, if you know in the future how much you will value these naps, you know, what are some of the things parents need to pay attention to when it comes to setting that pattern for your child now, so that they don't have problems as an adult? Because you can fix it now. You can nip some of these problems in the bud now, right?
Yes, yes. Yeah, you see, for children, it depends on how the parents train them.
Okay.
Like, there are parents who train their children to only sleep when there's light. And you find this child, even when they are old, they will require light, and this will inconvenience other people they are sharing the bedroom with or the house with.
Right.
Again, there are children who are trained such, they will only go to bed when mommy or daddy is next to them. Then this child becomes dependent on other people to be able to sleep. So you actually need to train the children early enough that this is bedtime. You put them in bed at the right time. You know, there are children who develop habits, especially when they're very young,
Yes.
of sleeping during the day and we're staying awake during the night, and everybody else wants to sleep during the night, and they can actually be trained.
Right.
Again, training them to be independent, to sleep in their own on their own bed as early as possible.
Right.
Yeah, all these things can be changed.
Just
But
creating
again,
a bedtime
yeah,
ritual.
you need to watch your children, because like the breathing problems I had said,
Yeah.
adenoids hypertrophy, very common with children.
Right.
You find children who snore a lot at night,
Yeah.
that this child, even if you insisted they sleep, because their breathing will be affected, they wake up, then again they start sleeping. Unless you remove those adenoids, the child will not be able to sleep well. So it's good if you find a child is tired during the day, or if the teacher reports that this child seems is dozing in school,
Sluggish,
don't just ignore it, especially if they're sleeping in another bedroom. It's good to check, because such conditions, if they are sorted out, then the child can live a normal life.
Okay.
Yes.
It is a big, big subject. I also want, just before we go, to talk about
Again,
sleep
tea,
apnea.
coffee. Don't give children tea, coffee.
Don't. And watch
Yes,
their
let
diet,
them take
of course.
cocoa.
A lot of natural products.
Yes.
Sleep apnea is something a lot of people don't know about, but and snoring, as you've mentioned, and a breathing issue.
Yeah.
You know, the funny thing is that some people who have that snoring problem sleep better than their partners. So your wife is stressed, she never sleeps, you've rotted, you've raised the sheets on the roof in that house, and you need help. Let's talk about sleep apnea and snoring, and then how it affects your health as well.
Yes. Obesity being very common in our society, it can cause some of those sleep apneas.
Okay.
And this is a problem where when somebody is asleep, all of a sudden they stop breathing, and they have to wake up and regain their sleep again, to take some breath and regain their sleep again. And I said it can be caused.
It can be fatal.
It can be fatal.
Yes.
Sometimes it could be a problem in the brain.
Okay.
Sometimes it could be in the breathing system, in the nose or behind the nose.
So snoring can be more serious than people pay attention to. We actually make jokes about it, but it's not a laughing matter at all. Yeah.
And it can actually cause death, as you said.
Yeah.
So it's very good to have a thorough evaluation, such that if there's a blockage, an obstruction, it's removed.
Right.
If it's about weight, you're advised on how to cut weight, because again, it affects your partner's sleep, and it causes a lot of relationship problems.
Absolutely.
So it's very good for it to be assessed and treated, because if it's not sorted out, it can even lead to death.
Absolutely.
Yes.
Daktari, we will keep this subject open. We will keep talking about it. Some people even just have bad mattresses. You know, some people are just sleeping in bad mattresses, and then you can't sleep. And some simple things that you can do.
Yes.
This is the first of a big conversation that we're going to be having here on AM Live. Why? We want you to sleep better. We want you to have more energy. We want you to be happier and less stressed. Because I can't imagine somebody who's stressed sleeping well. And I can't imagine someone who's not sleeping well not being stressed.
Yes.
Right? We have to arm ourselves with some information that will make our lives a lot better, people. All right? I wish I could send you all to bed right now, but it is Monday morning, and you all have to get up and get out and do something great. So let me make you smile real quick with the tube. Asante Daktari for being here. Thank you so much. All right, take a look at the tube, people.